The time is just gone 9:20 a.m. as we continue with the broadcast this morning on News and Views. We stay in the company of our Salam media listeners, our viewers on the various platforms, and also welcoming One Nation 88.9 FM out of Polokwane to the show this morning. Now, still to come on the show, we will be focusing on International Migrants Day 2022, which is going to be taking place this Sunday, the 18th of December. We also have got an interview with a company called Door Tag Networks integrated ICT solutions. Very, very interesting in terms of what ICT solutions can do for people and their businesses. And also, with the holiday season upon us, Durban on the verge of collapse. And not so long ago, we heard the KwaZulu Natal provincial department talking about a 4 billion rand industry over this period. Are people prepared to go to Durban, considering where the city is at this point in time and where the province is, particularly looking at the beaches? We will be talking with a Durban Community Environmental Alliance spokesperson. But right now, we're going across focusing on International Migrants Day 2022, particularly looking at healthcare and how healthcare remains a challenge for migrant mothers and children in Gauteng hospitals. We're going to be joined now by Medical Activity Manager at Doctors Without Borders South Africa, Dr. Tasanya Chinsemi. Tasanya, good morning to you and welcome to the show.
Thank you so much for having me.
Yes, clearly, looking at migrants and the situation goes from bad to worse. They are being challenged in more ways than one. We know about xenophobia and all these issues that have impacted, but healthcare, a critical service to the migrants, and it's a serious problem.
Yes, thank you for allowing us to have this platform to discuss. This is such an important discussion to have and an important issue to address. What we've seen is that there's increasing challenges that migrants are facing accessing care, particularly at hospital levels or at tertiary level. So access to primary care is generally okay, but once people need higher level care, we're finding that it's harder for them to access this. And part of the reason for this is some of the payment policies that are implemented in these hospitals. So to give you an idea of how it works, if you are South African or you have the appropriate refugee documents, you get what's called a means test. So a means test really means that it's first seeing how much you can pay and what you can afford, and you are charged based on that. So for someone that really can't afford it, they will not be charged very high fees. But what's happening for a lot of migrants, especially those who are undocumented, is they are being charged as private patients, and they're being charged really high fees that they really can't afford. And the group that we are particularly concerned about is pregnant mothers and children under six, because this healthcare is meant to be free for them, yet they are trying to access high level care and they are not able to get this. And so this is becoming a major issue. Our project is in Gauteng, and we've seen this at many of the tertiary hospitals in Gauteng. So the situation is worsening.
Yes. Now, Tasanya, this policy that you speak about, the payment policies, this is an official policy. I need to confirm that on the part of the Department of Health.
Sorry, I think I was muted. Yes, so it's actually a circular that has been sent out by the Gauteng Department of Health. I think it was sent out in May of 2020. So it is not sent by national, it's by the provincial Department of Health, and the tertiary hospitals are being asked to implement this. So it is an official circular that has been sent out by the Gauteng Department of Health.
Yes. Now, looking at some of the examples, and you mentioned that pregnant women and children, and I know that I was just reading this article where somebody from the DRC had visited a clinic, and she was a high risk patient and left untreated.
Yeah, so it happens. So what happens is, and this is not just an isolated case that we have. We've seen multiple cases of this where patients try to access care, and because they cannot pay the fees, they aren't able to open a file or even see a doctor or a nurse. And so what happens is that patients are then forced to either wait, not access care, and their conditions deteriorate. and they can become so ill, they can develop really severe complications, life-threatening complications. And what happens then is that they become emergencies. So in South Africa, we have to, on the Department of Health side, to their credit, is that they do treat everyone in an emergency situation. So they will not send anyone away in an emergency. So what happens is patients then deteriorate until they become an emergency, and that's the only time that they can access care. So with this patient, for example, she was a pregnant patient with a very poor history. She had previous miscarriages. She had miscarriages because of her previous high blood pressure. So she was really someone who needed to be monitored very closely, and she didn't get this monitoring until she became an emergency. The pressures were completely uncontrolled, and we had to refer. And she was seen eventually, accepted as an emergency patient, but that illness and that deterioration was not necessary. So there are many knock-on effects on patients, on the facilities themselves, on the whole of the public health system. The policy is really counterintuitive to what we should be doing.
Yes. Now, the authorities, what are they saying? The Gauteng Health Department.
So we are still in the process of engaging the Gauteng Health Department on this. We've tried to engage health facilities, and it seems as though the facilities, feel that their hands are tied. Many of them have said this. I don't want to speak on their behalf, but they've said that this is a policy that they've been given to implement. They're not custodians of this policy. They have to implement this policy, so they cannot just change it. The policy itself, I have to say, has contradictions in it because it does make provision, for exemption of fees for pregnant women and for children under 6. However, it seems like this is only being applied to South African pregnant women and children.
Yes, and organizations like yourselves, Doctors Without Borders, and we have been following the work that Doctors Without Borders have been doing worldwide. And in this particular instance, what level of support are you providing to Sanya?
So in anywhere where MSF works in the world, we don't seek to create parallel health systems or take patients out of the health system, and we don't seek to take away accountability or responsibility from departments of health. However, what we are trying to do in our project, we started as a migration project. We now support different vulnerable groups, but initially we were focused on migrants, and what we are trying to do is improve access to care and linkage to care. So instead of pulling patients out of the system and becoming a primary healthcare provider, we link them into current systems. So they see us. We have arrangements with a lot of the local clinics who, I must say, have come alongside us and really, done really great work with us. And they've accepted patients into their systems. They've helped to facilitate access to care. So that's what we do. We try and facilitate this care, but it relies on cooperation from the other facilities as well. And we find that at tertiary level, at hospital level, this is much more difficult because of these stringent policies that they have to implement.
Yes, to Sanya, this problem, is this unique to Gauteng or is it a problem countrywide?
Most of the evidence that we have is from Gauteng, primarily because our project is based in Gauteng, and the circular that I was speaking about was issued by the Gauteng Department of Health. So we have heard of isolated episodes of this happening in other provinces, but I can't really speak to that. What we're seeing mostly is in Gauteng.
Yes, and what options have you got at this point in time, apart from just making, noises and making submissions to the Department of Health?
So MSF is actually, like you're saying, we're doing a lot of advocacy in terms of speaking out about it. We also do we work with individual patients and their cases to try and facilitate access to care. So case by case, working with hospital. We have had hospital managers who've really come to the party and tried to help patients despite these policies. But the other thing that we are doing, and that is part of what we believe in strongly, is that we need to hold the Department of Health to, they need to be accountable. And so we are supporting litigation with Section 27 and patients who have been denied access to care, who have opened a case that is going to the High Court. And so we are supporting litigation in that. We've submitted evidence and affidavits for that case.
Well, Tasania, thank you very much for that and for taking time out, talking to us this morning and highlighting this problem. We wish you all the best. Take care. Dr. Tasanya Chinsami joining us, Medical Activity Manager at Doctors Without Borders, South Africa, ahead of International Migrants Day 2022, taking place this Sunday, the 18th of December. The time is just gone 9:30. We're going to go for a break. We'll be back.